Welcome again. Today we'll talk about artificial organs. The outline of this lecture we'll talk about artificial organ definition. Specifically speaking, we will talk about the artificial heart, artificial pancreas, and some other types of artificial organs in brief, like artificial eye, artificial ear, and other organs. And finally, we'll talk about the future of artificial organs. When we talk about the definition of artificial organ, it is a man-made medical organ, device, or tissue that is implanted or integrated into a human interfacing with living tissue to replace a natural organ, or to duplicate or augment a specific function or functions so that patient may return to normal life as soon as possible. Here, artificial organ will differ from organ transplant like heart transplant, kidney transplant, liver transplant, and other organ transplants. There we talk about implantation of a natural organ like natural heart from cadaver, from bodies, or artificial tissue from some human to replace the diseased or non-functioning organ. Sometimes artificial organs used temporarily, since most of the natural organs taken from bodies or cadavers are not available yet, and the life of the patient is at risk. So to save life for a specific time, sometime for 1 month or 2 months or even 1 year, scientists talk about artificial organ just to save life and enhance the patient status until natural organs to be available. We will talk about, specifically speaking, about artificial heart and artificial pancreas. Here is a picture for artificial eye to replace diseased or damaged eyes, sometimes in trauma or in accidents and in diseases. So the artificial organs, when we talk about the medical definition of this term, we talk about is a man-made device to integrate into body to replace the natural organ. We will talk about artificial heart in specific and artificial pancreas, since heart disease or cardiovascular disease is considered the most common cause of deaths in developed and developing countries, and using artificial heart or even heart transplant will save life of many people. It is considered a priority in relieving this problem. When we talk about some cosmetic issues, we will talk about prosthetic arms, prosthetic eye, or artificial ear, or even artificial nose, or even artificial face. But when we talk about functioning organs like the heart, pancreas, or lung, here we talk about artificial organs. First, we will talk about artificial heart. As I said before, the cardiovascular diseases considered the main cause of death, or even the first cause of death, is even in developed or developing countries. So the efforts taken to solve this problem will improve the mortalities among the populations in different countries, and will enhance or relieve or promote the quality of life of many people when using artificial heart, or even saving life for a specific period. When we talk about artificial heart, we will differentiate it from cardiac transplant or heart transplant. Here we talk about mechanical, not a natural heart. It is a prosthetic device that is implanted into the body to replace the biological heart, the natural heart. It is different from heart bypass machine. We know sometimes we need to use a device called cardiopulmonary bypass and other machine called ECMO, used to replace the natural heart and the natural lung, especially during the open heart surgeries. When we talk about open heart surgeries to replace valves or to even use grafts to replace problems in coronary arteries, the patient should be in a device to replace the heart and to replace the lungs by a machine. But here the machine cardiopulmonary bypass or even ECMO will be used for a short period of time. And when the patient is unconscious, but we need a conscious patient to live for 1 to 3 months to wait for the natural or the biological heart transplant. So we talk about here is only suitable. We talk about cardiopulmonary bypass machine for a few hours or during this time of surgery, open heart surgeries in specific. But the artificial heart basically is the heart. The only function of the heart is a pump, pumping blood. Basically, a pump with a lot of stabilities, lower the need for transplants. But the problem is the artificial heart just used for 2 months or even 1 month, just for wait for availability of natural heart to be implanted. Here appears the problem of foreign body rejection. The body will react to this machine and through the immunity system and could reject this machine and cause very severe problems. And here we should talk about the problem of using cortisone to overcome the problem of rejection. Here, when we talked about the history of artificial heart in 1963, first patent devices in University of Utah, the first patient with 61-year-old Barney Clark survived for just slightly more than 110 days. At 2001, PICOR self-contained approved for human use for the longest implantation for slightly more than 600 days. And the main use is still for folk waiting for transplant, as I said before, just for some months, or even may reach to, as appear at 2001, to could live for 2 years, just for waiting for biological heart transplantation, just here to save life and enhance the quality of life of this patient in this short period. Also, the problem of immunity of rejection will appear in both either cardiac transplant or even artificial heart. As we see, the heart normally contains 4 chambers, 2 ventricles and 2 atria, and connected with the pulmonary arteries, the aorta, the pulmonary superior vena cava, and other blood vessels. The most important is the 2 ventricles. The 2 ventricles which will pump blood to the lungs for gas exchange and through the aorta to the general circulation to enhance tissue perfusions to the brain and other organs. In the PICOR heart, we talk about 2 chambers connected with the natural 2 atria, here the right ventricle and the left ventricle, which are important to push blood or to pump blood to the lungs for gas exchange and the aorta for the general circulation. When we talk about artificial pancreas, we should talk slightly about the disease of the diabetes mellitus, which results from diminished amount of or absent amount of insulin, which is a hormone secreted by the pancreas to tolerate glucose in the blood. The pancreas will release insulin in response to the level of glucose in the blood. When the glucose level elevated, the pancreas will release insulin according to the level. In diabetes mellitus, the pancreas is not sensitive to the level of glucose, and the glucose level could be high and could be low according to the situation the patient lives. When we talk about the insulin pump, it is used to automatically deliver basal insulin continuously and bolus insulin at meal times by pressing the buttons. The patient will or the family will enter the value of blood glucose before meal, and the pump will calculate the number of units needed of insulin to help patient deal with the glucose level in the blood. Before meals, blood glucose value is entered into the pump, and to calculate the correction bolus to bring the blood glucose level back to the targeted value. Here is a picture about the pump. There is a mini link transmitted continuous glucose transfer here, and the infusion set here, and here is the pump. So the pump will release insulin according to the blood glucose level. When we talk about the future of artificial organs, the future of the fourth industrial revolution, we talk about the 3D printer and other revolutionary equipment could appear in the next few years, could help in enhancing the function of artificial organs and relieving the problems of chronic diseases like cardiovascular disease and diabetes mellitus. We talk about the bioprinter, the 3D printed organs, no longer needing the use of these scaffold to construct organs. We talk about OrganAvo, which has already created meniscus knee cartilage from 3D printer. Within the next 20 years, the 3D printing is projected to be able to create even organs resembling biological natural organs like the heart, the pancreas, and other tissues could need to be changed or implanted, such as skin tissue or other tissues in cases of burns and other health problems. The 3D bioprinting is hoped to be used for replacement of organs when the science matures to this stage. The process is under development. This will eliminate the animal drug screening through the use of printed cell tissues. Through the use of nanotechnology and genetic engineering, bioprinting may also prove to be an important tool for life extension. Printing cells directly onto the human body in order to rapidly heal the affected surfaces. Here we talk about the 3D bioprinting, introduction to the bioprinting, the origin of printing process, outline explaining the future and the printing tools. Bioprinting constructs 3D artificial tissues by computers, devices. Bioprinters can print complex 3D structures such as meniscus, and talk about skin tissues, heart tissue, liver tissue, within the combination of bioink and biopaper. Today, bioprinting is still at developmental stage, as I said before, and it is used as scientific tools, not in commercial, not for commercial use. It is expected to be used for creating replacement organs and the human tissues from raw biological materials. And here we could talk about the problem of immunity and rejection of either implanted organs and mechanical or prosthetic organs by using sometimes of stem cells from the patient himself, and this will lead to, but will appear the problem of ethics here could be a very big problem in the future when we talk about providing or manufacturing complete organs through the use of stem cells through the 3D printing. The origin of bioprinting, to talk about the spread between the demand for organ transplantation and the number of available organs. We talked before, we use prosthetic organs just to save life until the natural or biological organs will be available. These needs have led to emergence of evolution of tissue engineering, but this approach has met with little success until now. Bioprinting offered a new and innovative approach with the ultimate goal of building living tissues and organs capable of successful transplantation into the body and functionally similar to the native tissue. Here we could incorporate both the sciences of biology, using the stem cells with engineering to help build tissues could replace the normal organs with little adverse effects. Moving beyond the 2D cell culture, tissues engineering has been a promising field of research, offering hope for bridging the gap between organ shortage and transplantation need. However, the building 3D vascularized organs remain the main technological barrier. Here we talk about tissues, but when we talk about the nerve supply, when we talk about the blood supply, blood vessels could be needed or should be needed by the transplanted organ is very important, and this still it's considered a barrier to move toward producing these organs in commercial level. Organ printing, which is defined as computer-aided additive biofabrication of 3D cellular tissues constructs, has shed light on advancing this field into new era. Fiction meets reality. We talk about bioprinting is an automated computer-aided layer by layer deposition of biological materials for manufacturing or functional organs. Here, so can we see some printing equipment, artificial bioprinters have already been built. Novogen, an expert by Orgonavo and Invent. The bioprinter Orgonavo has made for the first commercially used bioprinter called Novogen, an X bioprinter. The printer has two robotic print heads. One replaces human cells and other places hydrogel scaffold or other type of support. The printer allows multiple cell types of components to be used for printing. Stem cells, as I said before, also used in bioprintings, and here could appear the problem of ethics and how can we manage it to prevent some moral and ethical problems could encounter this process. Here a conceptual bioprinter. Here the procedure or the process start with one layer. We can print layer by layer until the final tissue is completed. The processing, actual printing and solidification of the organ is done layer by layer. Placement of natural materials could be aggregates, can be achieved using a bioprinter. The bio-ink is prepared, resulting in bio-ink droplets containing single cell or cell aggregates and loaded into a bio cartridge. The bio-ink is sent through a syringe-like nozzle and deposited into the bio paper. And in a controlled manner. The precise replacement of the cells is directed by blueprint or model producing desired cells patterns and or constructs. In addition, each layer of cells may be separated by a thin layer by a biomimetic hydrogel that enable the resulting 3D tissue structures after the gel layer relax and tissue fusion occurs. And so the final tissue, which resemble the natural tissue, will be formed or printed. The bioreactor, here we talk about the supply nutrients for further cell growth, and we talked before about the need for this natural tissue, how the problem of innervation or vascularization of these tissues could be enhanced. This is still the problem and under development. And in the near, the next few decades could be solve this problem, and which would help in releasing or diminishing or reducing the problem of biological organ transplantation. Physiological environment also is needed for tissue maturation, and mechanical and bio testing is needed to ensure that the printed tissue will function normally without side effects, and this will be done through monitoring and regular testing. Post-processing, realistically, printed tissue construct should grow and develop in wet environments similar to native conditions. To achieve this state, perfusion devices such as a bioreactor are needed that enable the cell survival, but still under development. The printed tissues construct should ideally rapidly self-assemble, mature, and differentiate to the desired functional organs. It is at this step that the developing organ be subjected to chemical and biomechanical conditioning for proper development and accelerated tissue maturation according to specially defined parameters like perfusion, media, and regime. The growth and maturation of the organ should be monitored non-invasively to ensure successful development. Any organs, either the heart, the pancreas, or even the ear or nose, should be monitored by non-invasive measures to ensure that they develop successfully. When we talk about the current progress about the ear, the kidney, the blood vessels, when we talk about the ear, more than 250 million cells and collagen from rat tails make human ear in 15 minutes. Post-processing, 3 months to serve children with hearing loss due to malformed outer ear. But here also appear the ethical problems, and how can this the body can accept or reject these ears. When they talk about the kidneys, here talk about layer by layer building of a scaffold and deposition of kidney cells, assembly to be transplanted into the patient, degradation of scaffold to follow in vivo. When we talk about the blood vessels, rigid but non-toxic sugar filaments from core cells deposited around filaments, subsequent blood flow dissolves sugar. When we talk about the skin grafts, which could be used in cases of burns or traumas, laser can scan wound to determine depth and area. One ejects enzymes and second cells. Layer is finally sealed by human skin cells, useful in war and disaster zones when many skin grafts are needed. When we talk about the bones, printed scaffold with ceramic or titanium powder after 1 day, and culture of human stem cells is ready. Repair of complex fractures in accident survivors. Drug testing. When we talk about more than $1 billion make new drug in 12 years, 1 in 5,000 have a chance to make it to the market. About 20 to 50% drug fail from preclinical animal trials to human trials. When we talk about the future use of technology, it could be utilized to create entire living organs such as the heart, the liver, the kidney, the skin, the pancreas, the lungs, creation of functional human beings which can be printed on demand and reach maturity in a few weeks, newly developed. And here we could save lives of many patients who waiting for biological natural organs for years, or complaining in hemodialysis or with other functional organ problems for many years. Here, by these technologies could relieve and enhance the quality of life, and even saving life of patients in a few weeks. Newly developed drugs can be tested out by manufacturing cells than on animals, and this will enhance or accelerate testing the newly administered or manufactured drugs on human rather than animals, and testing the accuracy of this use to human being. Cytobioprinting works by imprinting cells directly into human body. Replace human tissues by full body transplant. Full body transplant. Allow scientists to eliminate the wait list of organs, higher survival rates, and offer high precise resolution to the many health problems could be encountered. The patients of the population, either cardiovascular, liver problems, diabetes mellitus, the problem of accidents, burns, and others. Bioprinting conflicts the moralities and cultural and religious beliefs, as I talked before when we talk about stem cells and these organs. Could this be conflicted by many ethical or religious issues? Bioprinting will increase the lifespan of people on resource-limited planet, increase in world population, and could be put more burden the economy and the systems, either the health care system or education systems, and the large populations. Fontaine, if less people will not grow older and die naturally. The replacement of, when we talk about the challenges, the replacement of molecules, the replacement of molecules or cells within the reconstructed organ is not sure about whether they can fit into human body as functional tissue. We'll talk about the innervation, we'll talk about the vascularization, blood vessels, which will help in the growth of these tissues. Large-scale construction increase the complexity associated by transplantation. Printing capabilities of complicated tissues like the liver or the lungs is considered a challenge. Until now, the liver implantation is considered a challenge. So when we talk about printing liver tissue, it will be more challenging. The necessary specifications required for giving printing structure, like for therapy design, need to be precise and specific. Thank you, and see you in the next